Good morning, everyone.
Good morning.
Thank you for everybody being here this morning for our agenda for May the 19th for the Chatham Area Transit Authority. And I'd like to call the meeting to order and the roll call, please.
Good morning, everyone.
Good morning.
Chairman Lakakis.
Here.
Dr. Thomas.
Dr. Thomas is out and asked that she be excused.
Thank you. Mr. Broker.
Here.
Mr. Dawson.
Here.
Mr. French.
Here.
Mr. Holmes.
Here.
Mr. Mangadolf.
Here.
Ms. Osborne.
Here.
Ms. Stone.
All right.
I motion to excuse Mr. Thomas from the meeting today.
Okay, we have first one, a motion on the floor to excuse Dr. Thomas for the meeting. I think she was in the hospital at night. She's back home again. But anyway, going past that, all in favor signify by saying aye.
Aye.
All opposed? Motion carries. Next, we have, we'll wait a while and see, I guess, for Director Stone, because I'm not sure whether she's coming today or not. She might have made a contact, though, to excuse her, but we'll wait just a little while on that. Okay, the next on the agenda is we've got two public hearings this morning. The first one is a proposed budget for the year 2015 to 2016, and we'll have a presentation on that. And the requirements are that we have to have a statement. Ladies and gentlemen, this hearing is being held in compliance with state law relative to Chatham Area Transit Authority's proposed fiscal year 2015-2016 budget. Information packets showing the proposed budget are available at the front entrance. A list is being passed around asking for the names and addresses of those present. The purpose of this is to document that public input was solicited for future audit purposes. We will start at the right side of the room and go row by row. If you wish to speak, please stand, state your name, address, and the name of the group or organization you represent, if any. We have staff available to help pass out any written material to the board members. We would ask that you be brief and concise in your remark, since we have a number of people that may want to speak, and we want everyone to have an equal chance to be heard. Okay, so now the meeting is open, and I'll call on our director now for that, or
Presentation.
for Terry.
Yes.
Good morning, and this is the second reading of our FY15, FY16 budget. So if you remember, we started in February with a workshop. Our first reading was at last month's meeting. We also had an evening public meeting at our regularly scheduled public meeting last Wednesday night. So this is the second reading, and we hope approval of our budget. As you see here, after that, the county commission will set the millage in June. So if you remember, our budget priorities are that our fare structure is going to be slightly adjusted. We'd like to move our fares from individual fares to agency revenue. We're working on our passes and our transfers in an effort to reduce transfer abuse. We're also working on rebranding our Telluride or our paratransit operations, and also continuing the certification and recertification of our members. We hope to set service levels that will allow us to continue holiday service. Also, a priority is our long-term funding. We want to continue to pay down our line of credit and eliminate this line of credit and the associated note over the next 4 years as we begin to build our reserves for contingencies, capital, and restricted insurances. Highlights of our budget, we're proposing a $21.1 million budget, which is a $1.5 million increase over last year. This assumes a 1% increase in the tax digest. News this week is good, and we do expect the increase to be a little bit more than the 1%. Our revenues, our fares are remaining constant. The paratransit revenue line includes a $600,000 increase and $300 for fuel that we're not usually budgeting. So of that 1.5 increase, $300 is mainly a book entry to correctly reflect the fuel that the county pays for, but we have to book. The preventive maintenance revenue increases 4%. We're still trying to limit our use of PM revenue to subsidize operations because we prefer to use that money in our capital fund. So on our expenditures, the majority of the increase has to do with maintenance. We've talked quite a bit about the fleet, and as it ages, maintenance cost continuing to increase. In the insurance category, the main increase was in our health insurance, and we have Secrets here to talk about that. While there was an increase, it was not a large increase as we first anticipated, so that's good news. An offset to the $300,000 in the paratransit fuel revenue line is also shown in the expenditures. We didn't make any adjustments from the first reading, so the second reading here today is exactly the same as the first. And that's all I have for the summary presentation. If the board has any questions or the public would like to ask a question or provide input.
Yes, sir, Mr. Chairman, and now it's time for the public hearings. If anyone has any comments.
Okay. You heard what Terry was just stating about what we proposed in the budget, the different items and all. And I'd like to ask start on the first row, and anybody on the first row would like to make any comments or ask questions about the budget. Anybody on the first row? Okay, we'll go to the second row, starting on the right-hand side also. Anybody on the second row would like to speak about the budget? Have any questions, or you would like to make any comments? Any comments or questions for the second row? And I see the rest is employees that we have, staff members and all. So if seeing none that want to speak on the budget, I'll call the budget hearing to a close.
Mr. Chairman, I'm sorry I was late, but they pulled up the cones before I could park, so I had to go around to the parking lot.
No, that's okay, because we waited.
I'm sorry.
No, that's all right, because we waited before we, went into it. Yes, Mayor.
We didn't approve the minutes.
Oh, that will come.
We've got one more.
Oh, I'm sorry, excuse me.
I did the same thing.
Wayne asked me. Yeah, thank you, sir.
No, sir.
Okay, the second public hearing statement on the fare policy adjustment. Ladies and gentlemen, this hearing is being held in compliance with CAT policy and the Federal Transit Administration regulations relative to a fare policy adjustment. A list is being passed around asking for the names and address of those present. The purpose of this is to document that public input was solicited for future audit purposes. We will start at the right side of the room and go row by row. If you wish to speak, please stand, state your name, address, and the name of the group or organization you represent, if any. We have staff available to help pass out any written material to the board members. We would ask that you be brief and concise in your remarks, and we don't have a lot of people here right now, so if you want to go a little bit longer in your remarks, you're welcome to do so. So we'll start on the right, the first row.
No, we
Excuse
gotta
me.
do the presentation. Mr. Chairman.
Okay, all right, the
So,
presentation.
These are
Yeah.
proposed fare changes for October. Shalonda Roundtree will give the presentation. She's our marketing business development manager. This is the first of 3 or 4 meetings we're gonna have. We're gonna be meeting with the Step Up Savannah to solicit input from the resident council, our transit advisory board, our business advisory board, ACAT, and then next month we hope to bring it back to the board for adoption with any modifications for a final fare adjustment. So, Shalonda.
I got this way, okay. I went the wrong way.
That's okay. We're just here to present to you a few of the changes that we're making to our current fares. The proposed date is October 2015. The goals of our fare changes certainly are to definitely improve the efficiency and convenience of fare payment. Right now, a lot of the times most of our passengers are using cash. So we are really trying to aggressively move them away from cash to more effective ways and more modern ways of using transit, which are passes or smart cards. Speed boarding and reducing dwell times at bus stops, reduce cash payments, increase use of prepaid media, fare box recovery, and minimize fare evasion. Obviously, we have talked about that a lot in a lot of board meetings about fare evasion. So we hope that a lot of the changes that we're making, that we're proposing for October, will help us kind of minimize some of the abuse that we're receiving from some of our passengers in our transit. Summary of proposed changes. Obviously, we have already discussed the increased paratransit fares from $180 to $2, the 10-ride ticket book from 18 to 20. Some new changes that we're presenting today are the weekly pass, which is currently $16, will be reduced to $14. The monthly pass, which is currently $60, will now be $50. Presently, our youth and students ages 6 to 18 pay the normal fare of $1.50 for transit. So we are proposing to have a youth or student rate. Ages 6 to 18 will be eligible for the half fare. Also, our senior, disabled, and Medicare, currently the only form of payment that they are using for half fare are our $150, our regular bus fare. So we're also proposing that they have the date and monthly pass at a half fare discount. Change cards will be discontinued, and our half fare, which is our 20 ride pass, will also be discontinued. One of the things that we're hoping also as a result of this is that by discontinuing the half fare and making the other fares a little bit more affordable, we think that that will be another way to kind of move people away from the paratransit to that, because it will be a substantial discount for them. So we hope that that will be really attractive and will help us with that goal. Also, we're proposing to revise our transit rules, limit to 1. Currently, they can get more than 1 transit transfer. So we're hoping that, or we're proposing that they only have 1 in the 90-minute span. This is just a recap of just kind of a side-by-side comparison of our current passes versus our proposed. 7-day, of course, that is now 16, will be 14, 60, 50. Just for you to take another look at that. What we have here is we've compared some of our peer agencies just to kind of give you an idea of where we are, and just that we're in the pretty in comparison to a lot of our other transit agencies. So this is just to give you a visual of looking at some of our other transit companies and their costs, and to say that I think that we're pretty much in the ballpark of some of them. Certainly in Jacksonville, you see that their cash fare is $1.50. And our monthly pass will also be $50. Now we've reduced that, so that's pretty close to that. Schedule a public meeting.
Wait a minute, what I'd like for you to do,
yes,
read off the Cat Savannah, over there, because people, if this is going to be broadcast, and I think we
okay,
should on public television, especially the county, read that right there on that, because that's important for people to know that we are less than a number of other places, and about, we can see the difference there.
Okay, Chairman. As you see, the cash fare is $1.50, which is in line with several of our other transit companies, our peer agencies. One of the things that we're asking for is exact change only. So currently, passengers, if they're boarding the bus and they have $2, they have been entitled to a change card. That will be discontinued, so they will need to have their exact fare, or we're encouraging to be able to purchase a pass. That will alleviate them needing to have change or anything, because now change cards will be discontinued. The day pass is $3, and you see that's pretty in line with most of the other transit companies. $14 for the weekly pass, and that's probably one of the, as you see, one of the cheapest up here, is most affordable. So we think that we're definitely have really looked and researched the rates, and we think that this is affordable for our passengers. And the monthly pass again is $50. So we could look at Jacksonville is $50, and also Knoxville is $50. Some of the others are a little bit higher, so I think we're pretty, and we hope that this will accomplish our goal to move people away from the cash fares to look at monthly passes. Is that okay, Chairman? Did that? Our schedule of public meetings. Today serves as our first public meeting / public hearing, where we're presenting to the public these proposed fares. Additionally, we're going to be partnering with Step Up Savannah on May 27th. We will provide the location and time of that. That has not been determined yet. June 10th is our next public meeting, and then June 16th will be our final public hearing and our board meeting. And that will be where the board will be able to decide and review from our robust community outreach marketing of this, to make sure that the public is engaged and have an opportunity to respond. So we will post it on social media, we'll have it on the website, we'll make sure it's on our TFTs, it'll also be posted again in the newspaper. And then we'll also look for other opportunities to partner with community agencies. If there's any opportunity that we can go out and speak to them and communicate to them about some of the changes, we'll certainly be available to do that during this time.
Bill?
Could you maybe tell us a little bit about why it's so important for us to meet with Step Up Savannah, that they're included in one of the public meetings?
Well, I think that a lot of our passengers, Step Up Savannah, first of all, they can relate to a lot of our passengers. A lot of their services help us out. It's a great partnership to have. We think that some of the people that we may not reach, Step Up Savannah can help us bridge that gap. And we hope that they're already signed on, they know about the proposed fares, they're in support of it. And we just hope that they just help us get the word out a little bit more for those people that may be impacted by it, or just need to get a little bit more understanding of the importance of moving to passes, and that it will be more affordable.
Yeah. You might also want to mention the, I'm sorry.
Go ahead.
You might also want to mention the role Step Up Savannah played in the institution of the transfer program as well.
Yes.
Yeah, we're aware of that and the role they play, because I think we looked at redoing the fare about 5 or 6 years ago now. One of the proposals was to eliminate transfers, and they were really out front with the need of keeping the transfers in place. We've had a meeting with them before we actually went public with this, just to weigh in and gauge where they were in the process. And we expressed to them our concern that the transfer system is being abused. And they were on board with us, working with us to address the issue, particularly when you put it in light with a reduced fare for a long-term usage.
Also explain what Step Up Savannah is. I think that's important because you've got a number of people, of course, Chad, that don't know what Step Up means.
Well, Step Up is in its name that the community needs to step up to help address some of our community's issues and concerns with low-income, poverty initiatives, so on and so forth. So they are who we have looked to as our partner since I've been here in terms of being able to understand what CAT's role is and how do we work together to address some of those concerns.
Two comments. One is
Mary.
on Step Up, and that is, if any of you gone through the simulation, the biggest problem the customers, families complain about or have need of is transportation, so I think that's good. Second thing is, I noticed that you didn't indicate that you will be putting this on the Savannah station, Savannah City Council's channel, and I think it's important because maybe everybody doesn't watch the county, then you watch the city one, and I think it would be a good idea to put it on that as well.
What I usually do, Mary, is whenever we have anything, I request the county with Pete, and then the city with Brett Bell to put that on, because it's really important about our CAT situation, and I'll make sure that I continue to do that as you just stated.
Thank you.
Bill?
And just one other comment before we leave Step Up entirely. Step Up being the city's, poverty elimination program, one of the things that seems to be sort of a burgeoning issue or a burgeoning realization is that transit is an extremely important part of people moving out of poverty. The ability to leave the neighborhood where one lives and to get to a job is really, really important. And the research that I've seen recently is indicating that transit is one of the key factors in people's ability to move out of poverty and to engage in gainful employment. So I'm really glad to see this kind of relationship with Step Up. Step Up did a really good job bringing the whole transfer issue to us. You may remember Millie Rivers making her presentation and how important that was. So I'm really glad to see that we as the Transit Authority recognize what a key player we can be in poverty elimination.
Okay, anything else?
That's it, Mr. Chairman.
Okay, I'll go on the first row again. Anyone on the first row would like to ask questions or make a statement on the fares and what was just presented to us? Anybody on the first row?
Yes. My name is Alonzo Lonnie Halston. I'm the chairman of the Transit Advisory Committee. We met on last Thursday and thoroughly discussed in detail the changes of the schedule for 2016, 15, 16, and we unanimously approved it.
Okay, second row. Anybody on the second row would like to ask questions or make a statement concerning the fares? Anybody on the second row? Okay, then I call the public hearing to come to a close. We'll move on to the next item, and that's the approval of the minutes for April the 21st. Do we have any corrections or additions to the April 21st meeting minutes?
Move to approve. Second.
I have a motion on the floor and a second for the approval of the minutes for April the 21st. All in favor signify by saying aye.
Aye.
All opposed? Motion carries. Item 4, action items. The budget and recommended millage adoption fiscal year 2015, fiscal year 2016. Chad?
Thank you, Mr. Chairman. Staff is requesting the board approve the FY 2015-2016 budget as presented, and to request the Chatham County Board of Commissioners set the 2016 millage rate at 1. The staff had the proposed budget as operating budget of $21,154,472, an increase of $1.5 million from the previous fiscal year. CAT has held the public hearing as required by law. We've had 2 in the day and 1 in the evening. The latest one occurring today. At this point, we're requesting board approval of the proposed budget.
So moved.
Second.
Any discussions on that? Helen?
Just, having sat on this board for many, many years and watching the evolution of it, if you will, I'm just really amazed at the turnaround financially of this organization. We're paying down our debt, we're not looking at a millage increase, and we're doing it under some pretty tough times. So I just want to acknowledge that. I mean, I think that it's pretty remarkable to see.
With that, of course, I'd like to tell all the board of directors that you've done an excellent job. We have the top executive director in the USA, and he and his staff have done, almost miracles about how the turnaround has been, as what Helen has just said, because it has made a big difference. Because one of the things that we have done, we can see the financial situation and how it has gone along, and especially with the leadership of Chad. And of course it makes a big difference, because hopefully that with this increase that we are able to do more, and hopefully with the federal government doing some grants and all for this needed things that we need to do. And of course we will continue to keep with our leader and to do the things that are necessary to make us one of the best, if not the best, in the South as other places around the country. So thank each and every one of you for your participation. Next.
Need a vote.
A vote for the budget and recommended millage adoption.
I already made the motion, we just need to
right.
Was it seconded?
Okay, we have a motion on the floor and a second. All in favor signify by saying aye.
Aye.
All opposed, motion carries. Budget amendment for fiscal year 2014, fiscal year 2015. Chad?
Thank you, Mr. Chairman. Staff is requesting the board approve a budget amendment fiscal year 2014-2015 budget to provide for the increase in revenues and adjusted expenses and associated. We looked at the revenues and expenses over the first 9 months. I proposed this budget amendment, which represents $133,000 increase in both revenue and expenses. It's important to note that CAT will come in with a balanced budget this year.
Need a motion on the floor.
So moved.
Second.
Any questions?
It's sort of off the subject, but it's not, because it's in the proposed budget. There was some discussion at our workshop about employee passes for the county. Was that followed up on?
I met with Michael Kegler yesterday to discuss it, and we are sending him a letter that we promised to him this month.
Okay.
So the county.
I want to make sure that the same opportunity was provided for the county employees. That's all. It was brought up at our workshop.
Okay, all in favor signify by saying aye.
Aye.
All opposed, motion carries. Next, the insurance renewal. Chad?
Thank you, Mr. Chairman. Staff is requesting board approval of Chatham Area Transit Authority employee group insurance coverage for health insurance, health reimbursement arrangement, dental, vision, life, short-term and long-term disability. We have Ms. Terry Doyle here from Seacrest Partners to give us a presentation and information is in the green folder report. Terry.
Thank you, Chad. Thank you, Mr. Chairman. Again, I'm Terry Doyle from Seacrest Partners. We are the insurance broker as far as employee benefits are concerned for CAT. And before you, you have an executive summary of the renewal. The package renews July 1 of this year. On the health insurance, we're continuing with Blue Cross Blue Shield of Georgia. Last year we had an opportunity for some savings. We changed the plan design from an HMO to one POS plan with a $2,000 deductible. It saved approximately 13.45% off of that renewal. when we plugged in an HRA, which is a health reimbursement account, it still was an 8.4% reduction in the premium. So for Chatham Area Transit employees renewing for July 1, we went in, our Blue Cross came in with us with a 9.5% overall rate increase. We negotiated that down with Blue Cross Blue Shield to not have any increase on the medical portion of the coverage. However, there was a 4.5% increase that merely took in all the ACA, which is the Affordable Care Act, taxes, fees, and that are associated with the act. So really the 4.5% has to do with the taxes and fees through ACA. So it wasn't passed on the medical. In addition to that, with ACA, the out-of-pocket maximum that employees are responsible for from this point forward, the co-pays, deductibles, and anything they pay out for prescription drugs goes into one out-of-pocket maximum. So if we leave the plan design exactly the way it is and leave that out-of-pocket maximum to $2,000, all of that goes into that bucket, and that resulted in the 4.5% increase. If we took that maximum from $2,000 to the government maximum now, which is $6,600, again, everything goes toward that pocket. There was a savings opportunity of 5.88%. We also looked at taking that traditional plan and looking at self-funding the benefits, with Blue Cross Blue Shield being the administrator. That did not produce a savings opportunity this year for CAT. So our recommendation was to continue paying 70% of the employee premium, which is what CAT pays, and continue with the current plan with a 4.5% increase on the medical. And you can see on this first page, these are the medical rates as they are right now, as they will stay. The health reimbursement arrangement we put in last year, as you may remember, we took the employees from a $500 deductible to a $2,000. Big, huge increase for them. With the health reimbursement account, CAT will fund the second $1,000 of that deductible. So I am the employee of CAT. I have a $1,000 deductible. Anything over that gets reimbursed through the health savings reimbursement account. So we put that in last year, and we have an administrator that does that, and the administration for the health reimbursement account is staying the same at $4 per employee per month, and it includes all the HRA administration, the FSA administration, the disbursement of the debit cards that they have in their possession, and set above the implementation fees were waived and the annual fee reestablished. So Admin America is that provider. And the current reimbursement amounts are $1,000 for an employee, $2,000 for employee plus one, $3,000 for employee plus two, and $3,000 for family. So in other words, those big, large deductibles are offset by the health savings, our health reimbursement account. So we are recommending that remain the same as well. The group dental, which is also with Blue Cross Blue Shield, there are no rate increases on the dental. It stayed the same, and so did the benefits, so there's no increase there. So we're recommending that stay in place as well. On the group vision, which is with DSP, Vision Services Plan, that is also renewing with a slight increase of 3%. If we change the plan design a little bit, we can back that down to a minus 2%. So not a lot of difference there. We recommended that we keep the vision plan in place as is. The group life and disability is with Cigna. Cigna came in and renewed everything, basic life, the group AD&D, short-term disability, long-term disability, the supplemental life, and the employee assistance program at no increase at all. So they are establishing their plan again at no increase, and they're continuing that for another 24 months. So no increase on the Cigna. We did look at Cigna and asked them to give us a quote of taking those classes that we have. Currently, the benefit is 1 times the employee's basic annual earnings. We asked for a quote to increase that to 2 times basic annual earnings for the classes other than the union classes. So for the non-union classes and the executives, Cigna came back to us and said they would do that with the new census we submitted, and there would be no increase in the rate. So they established the rate, they kept it the same. Of course, your volume would go up, so it would cost a little more to do it, but they just notified me this week that there's no rate increase. So that's a good opportunity to increase the lifetime AD&D at no increase in the rate.
Any questions for Terry?
Just a curiosity
Mary?
question.
Yes.
With this plan, what kind of responsibility of co-pay do the employees have when they go to a physician?
They have physician office co-pays,
It's $25
$25
regular
for-
visit and $50
Excuse me, I can't
for
say it
it's
again.
25 for a PCP, a primary care physician,
25?
$25, and then $50 for a specialist.
And your copay counts towards your deductible under the new program.
That is the plus that everyone can see with their plans is now we have that out-of-pocket maximum that everybody had, but your deductible didn't count towards that. Nothing, your copays didn't count towards that. Your prescription drug copays didn't count toward that. So you have that bucket sitting there that only took effect when you were paying your co-insurance percentages. So now everything goes into that bucket. And right now the plan design is a $2,000 100% plan. So once that employee meets that $1,000 deductible, they have 100% in benefits because CAT is actually funding the second $1,000 should they get there. And let me just say one thing about that. We did an analysis on the HRA plan. Typically, we try to budget, say, 25 to 30%, take advantage of that. In CAT's employees, they were only less than 2% actually took advantage of that second $1,000. So you can see they're not, meeting their own $1,000 deductible. Their expenses are pretty much under that. So the overall loss ratio for this group was very good, and I think that opportunity came because we changed the plan design yesterday and got everybody on board with the HRA.
Helen?
Just a comment. I would have liked, you said just yesterday, so I don't know if this was available, but, to actually see it ahead in case I had any questions. But Chad, are we following up with any type of a wellness program like Chatham County is?
Yes, we are.
Yes, we are. And if you look at, and to answer your question, we did present this earlier. The only thing I heard yesterday was my new Cigna quote, changing the.
Okay, but I mean, this wasn't given to us ahead?
No, we just.
It would be
But
helpful.
we can do that.
In the future to be able to read it ahead because I like to do some comparison and just looking at it right here, right now is a little bit different.
Absolutely. And my card is also in the folder too, if you have any questions. But if you
but-
look at the last, where we're next steps, one of those is the wellness program.
Mhm.
We've looked at several programs and we're having presentations from some wellness vendors. Our first one is Blue Cross Blue Shield of Georgia, who has some wellness opportunities for this group that are included in the medical premium, and we're going to start there. And we'll have a separate meeting with them in the next week or two to talk about their wellness initiatives.
But are there incentives?
We're going to talk about that as well.
Okay, because if you are a smoker in Chatham County, you're going to pay more.
Right.
Or you are paying more. And I just, I think that nationwide, everybody's looking at this because it's not fair to the employees that try to take care of themselves to have to pick up the tab for those that don't.
Absolutely, and we all know that if you don't tie some kind of incentive to it,
Right.
and the employee has some skin in the game, they're not going to be adherent to the program. So
That's why
we'll
I'm
definitely
asking.
be doing that.
And the county has somewhat of a format. If you want to look at it, I'd be happy to help facilitate with that, to save CAT any money humanly possible.
Absolutely.
But also, we're finding that with Chatham County, our employees feel better. They're missing less amount of work. And so it's a win-win situation.
Yes.
So I would
And I'm familiar with the county's program.
Okay, well, I'd be happy to assist in that.
Thank you.
In any way possible. But I want to see us do the best we can for our employees and for the organization.
Howard?
Yeah, the first is a comment. I mean, I think the 4.5% increase in today's environment It's probably as good as we could possibly expect to do.
Yes.
So I think you can give an applaud for that.
Thank you, thank you.
Secondly, just so I'm clear on it, with the increase from 2,000 to 6, if we're a standard CAT employee, maybe I'm married and I have a child or two, is this going to cost me any more money, do you think, by the time you pull in all the co-pays?
No, actually, I think it's gonna cost you less money. And when you look at that 6,000, that's really the family deductible. So it's, 3 per family. So you're gonna have a maximum that you're ever gonna pay in those deductibles. But as an individual, it is the 2. But because of the HRA, it's $1,000. So it's still a very rich plan as far as benefits are concerned, because you have $1,000 deductible and 100% benefit after that.
So you're confident that the employees aren't taking another step backwards this year?
Absolutely not. Absolutely not.
Actually, it's an improvement.
An improvement. Because if we leave the plan at that $2,000 out-of-pocket max, and now we're funneling all the RX into that, it is a better deal for them. Because when you think about the typical employee, what do? They go to the doctor and pay a copay, and invariably they get a prescription and they pay another copay. That was always just out of their pocket, but now it is going into that bucket, which is much better for them.
Just want to make sure it was a deeper bucket.
Yeah.
Any other questions for Terry?
And just the write-up or the summary of what she presented today in more elaborate form is in the facts and findings of the board report. So the 4.5% increase, as you said, that 4.5% increase is associated with the Affordable Care Act, and then the other programs that are there. So staff is recommending that the board approve the employee group benefits and health insurance program as outlined.
So moved.
Second.
I want to make a statement on this. Seacrest is a top company and has some of the top people, employees and all working, and we can see at the last presentation that was done that they went into some detail. They checked with other companies other than the ones that we had at that particular time, and saw that some of those increases that some of the other companies had were much higher than what we were paying, and so that made a big difference, especially to have somebody that with Seacrest that goes into it, because we want to have, as is right here, all of this information on medical, dental, and vision, life, disability, and all of those are important because we need that for our employees. And in here, it covers more than the ordinary employee things, because unless they put it in as as one of the additional benefits that you get, is usually higher, and then the same thing on disability. So dental and all of those have made a big difference. So we can see that Seacrest has done, a lot for our employees, and to do is a good job in saving us money overall. So now I'll call for the vote. All in favor signify by saying aye. Aye. All opposed? Motion carries. Thank you very much, Terry.
Thank you.
Next is the presentation, CAT service area expansion. Chad? Oh, excuse me, dump the pump for 2015. Yeah, that's a nice thing, and I think Chad wants everybody to put on some special costume or something for that. Go ahead.
Thank you, Mr. Chairman. This is for our annual dump the pump. Sandy has a resolution that we'd like to read and have the board adopt.
Whereas June 18, 2015 marks the 10th annual National Dump the Pump Day, as the day that encourages people to ride public transportation to save money, protect the environment, reduce our dependence on foreign oil, and improve the quality of life for all Americans. Now therefore, the Chatham Area Transit Authority Board of Directors resolves as follows. Section 1. Declares that Chatham Area Transit will join with public transportation systems across the country and participate in the 10th Annual National Dump the Pump Day on June 18, 2015 by encouraging citizens to ride public transportation. Section 2. The Chatham Area Transit declares that by using public transportation, people save money, help the environment, reduce dependence on foreign oil, and improve America's quality of life. Section 3. That Chatham Area Transit declares that public transportation is an important part of our nation's transportation system and provides citizens with travel options other than driving a car.
Okay, any questions? Any questions on that?
Do we need a motion to
You need
accept
a
the
motion,
resolution?
yes,
So moved.
Adopt the resolution.
Second.
All right, we have a motion on the floor for dump the pump. And, any questions on that?
I have one question.
Go ahead.
I have one question about the contest. So you've got 3 different people, a bicyclist, a City of Savannah employee, and I forget who the other one was, but they're all going to leave at the same time. Whenever the person in the car goes to the destination point, does that include time to find parking?
Yes. They never win.
I was going to say.
Sean always wins.
Yeah.
Any other comments?
Is there anything special we do for riders that day?
We can certainly look into it. To encourage dump the pump, yes.
Okay, anything else? Okay, all in favor signify by saying aye.
Aye.
All opposed? Motion carries. The cat service area expansion, Chad.
Thank you, Mr. Chairman. We have Rob Gregg here from the Center of Urban Transportation Research. Unfortunately, his colleague Bill Morris isn't with us this morning. He's under the weather. He hung out on River Street too long last night, partaking in some of Savannah's famous punch. But
spending money.
But as part of the legislative initiatives for this year, one of the things that was proposed was for CAT to look into an expansion of the CAT service district. And initially we began the process of conducting a feasibility study in-house, but what we later decided to do was maybe we needed to have outside professional do it, and so that the report would not be biased by it being performed in-house. So we have a contract with Center of Urban Transportation Research, and you know Rob, who completed our Making Connections, our strategic plan. So we re-engaged them to come back and conduct the study in terms of what if we were to expand the transit district. So Rob and he gave me a copy of the draft report last night, and we'll be discussing it among staff, but it's a final draft, and so we will have to get some comments back and some further recommendations. But Rob is here to make his recommendations to the CAT board in terms of the next steps. And what we would like to do, request to do as staff, is to take it, go through the report, digest it, meet with some of the stakeholders in the community, and come back to the board with the final recommendations for a vote at the next, at the June board meeting. Okay, so Rob.
Well, thank you, Dr. Reese. Mr. Chairman, members of the board, it is certainly a pleasure to be back with you all, and if I could wave at Terry every now and then to change the slides for me. I think what is pertinent that Dr. Reese mentioned is we had the opportunity that we're proud of doing the Making Connections, your strategic plan. And so you'll see as we did this analysis for West Chatham County, what's imprinted on that is that mobility management type of approach. We certainly looked clearly at bus service, but we also looked at other opportunities for other markets in that area. So our chore, and I think you all had seen this a couple months past, was to look at the overall service needs and connectivity, to develop some service improvements, and to examine a potentially applied local funding source. The task, again, I won't read everything to you because I want to run through it. I'm always given 15 minutes and I'm doing my best. But it was essentially to look at demographics, look at the facts and figures. Most important, and thanks to Mike for helping us, we connected with the local officials in the municipalities out in the west side of the county. And then we had 2 public workshops I'll be talking about. If you all recall, when we did the master plan, the strategic plan for y'all, we used a cutting-edge estimation tool to do some modeling. So we added that to the effort of this analysis. And then we came up with some alternatives and some costs, and I emphasize this is a feasibility study, but I think it gives you a good sense of alternatives and costs. Next slide, please. Thank you. So I'm trying to put this on one slide in a nutshell, but there was certainly outreach to the local officials. I personally talked to mayors and representatives of the local government. We had 2 specific sites for workshops, one in the city of Pooler and one in Garden City. City Pooler was a lot of fun. We had a good crowd there. I do want to thank a number of board members who attended both those workshops. I've collected just the sense that we got as well as our perceptions of the kind of feedback we got. Very strong concern about taxation, concern about a number of the representatives, particularly in the Pooler area, concerned about taxation and not hearing from the public that they needed service. There was a sense in the smaller municipalities that were rural and small town environments, what kind of service do we need? And I would emphasize that's that kind of that fear and feeling of large buses. There were some comments that we received from citizens on that. In the Garden City area, it was more of a kind of an open question of wanting to know if there is a need, but being cautious again about taxation. Maybe a little bit of confusion overall about how a revenue stream does come from ad valorem, not really understanding CAT's authority and where the tax comes from and how it's prescribed. One thing to emphasize, and you'll see it in the recommendations of the alternatives, is particularly in Pooler, it's not unlike any other part of the country where you have suburbs start to boom and development start to boom, and all of a sudden a mall smacked in the middle of things and congestion occur. In line with our strategic plan, that's a place where you start to take a look at some commuter assistance alternatives. Next slide, please. And give you a sense of the public input and the outreach. When we were in the workshops, we gave them some concepts. We talked about bus, we talked about paratransit, we talked about this flex zone service that we have in our strategic plan, and most importantly, something we're working with Shalanda right now on is developing a commuter service, particularly a van pull service that has lots of benefits, and that's a presentation in itself, but it's to reach that choice market. And particularly, again, in a suburban area like Pooler, there's an opportunity with major employers maybe to foster a van pooling service. So we have that in the deck for you as we move ahead. We looked at specific areas trying to help us identify origins and destinations, looking at quality of service and expectations, and other issues and concerns. We handed out customer comments, and we received comments as such. And we were really grilled and had a lively conversation in Pooler again. Next slide, please. This is just an illustration, comes from our strategic plan. We delved into a discussion just to help understand that we don't necessarily have to have fixed route buses going to just every quarter of a mile with a stop, but the concept of looking at an area and almost having certain key stops, but have that area that route be flexible so that when the demand is there, we can adjust it. It's somewhat of a popular type of service that's developed, again, across the country. And so, again, we put that out there. I just wanted to emphasize this. You don't really have to jump into this. This was an illustration, an explanation from our strategic plan. Next slide, please. And then, again, from our strategic plan, but you'll see some focus here now on the West Chatham County area, was this van pool program. Really taking a look at choice market, looking at common destinations. I've had wonderful experience myself with van pooling, where the van is the participant's van to use for church over the weekends, gatherings. You have a camaraderie going to work, less absenteeism, and also some tax benefits for the employer as well as the employee. I'm being real brief in that description for you. Next slide. So most important, and again, just to pick up on the previous discussion of the board, Mr. Broker's point, we looked at existing conditions and demographics, and particularly, well, who would ride service if it existed. And there are some affluent areas in the West Chatham area, but there's also key populations that need access to services, need access to jobs. I think the numbers we looked at in general, this pooler had about a 10% population below the poverty level. Garden City quite a bit higher at 20%. So these are the kind of demographics that we look at and are part of the modeling process.
Did you have any questions very much about the low income, people of poverty in the cities that you spoke?
I can tell you, Mr. Chairman, it was clear that they didn't attend the meetings, because perhaps they couldn't get to the meetings, but we didn't. We had concerns at the local level. The representatives, the same, and one side of us were concerned of taxation, and we're not hearing a demand for service, but also recognizing there's a future for public transportation. So it was kind of that feeling there's a future, but we didn't have direct comment at the workshops about lower income.
So none of the, I guess, the board members, the city council people, did they come with any comments about how much poverty they have in their area?
Well, again, our job is to take what might be said and commented on, but then also bring in some facts and figures of demographics that we know from the census. So there is and this is common, there's a perception issue sometimes that nobody would use it, but then maybe the perception doesn't think about some of the elements in the community that need access to education and need access to jobs.
Wayne?
Yeah, I was just going to say I attended the one in Garden City, and they were actually looking to the future. And they were pointing out that they get added benefits or added points when they were applying for money from HUD in order to be able to, if they had public transit there.
Right.
So there was an added benefit in addition to the obvious benefit.
Thank you, Wayne. And maybe while I'm there, because I was going to point that out a little bit later, but there is another benefit, access to jobs, but particularly Garden City had plans for affordable senior housing. And what Wayne is talking about here is there's a benefit that in your package to get either federal or state funding for affordable housing, access to transit, access to mobility. So it really, this all melds well with our strategic plan and the goals of the city. Again, don't go blind here. I've given you some handouts and this report. But if anything, I want to illustrate to you today, and we've got a little write-up and everything, but I'm going to be real light on my description here for time. What best I could illustrate is in the background you see these gray lines. Well, that's the existing network, the existing fixed route. And all of the colors you see there, although blurred a bit, are the alternatives we looked at. When we first went out in the workshop, as some of the board members recall, we just had a line out there that we modeled. and it didn't perform real well because that was our straw man. It was to get feedback from the community and a perspective. But as you're going to see today, when we looked at various alternatives, we have some winners as far as fixed route goes. But my emphasis to you is, as you evolve and emerge as a full-blown county or regional system, you need to have that network, because just a route out of nowhere may not produce as well as a route that's then connected to an entire network and affords multiple destinations. So I'm going to, again, for time's sake, just point out that you can look at the alternatives when you do have time to absorb this. But if you look at particularly the Brown route, serving kind of a north-south perspective and serving Pooler, the Blue route serving Garden City, and the winner of it all, the Green route, serving as a circulator within Garden City. Again, jumping ahead and just trying to keep things at pace here for y'all. That Green route, we project ridership. It's not just now. So when we use the modeling technique, we went out to 2020, and that Green route performed almost at the top of your entire system.
It would rival Abercorn.
So there you go. You have, if anything gives us a sense of need, is a reaction like that to putting a route out and modeling. Next slide, please. And these are the other routes. So again, not to strain your eyes, but to illustrate, these are all of the routes that are performing now in the system, and the bottom was these routes that we tested. And I put my little colored checks of blue, yellow, and green. And again, to emphasize, we end up with a projection in 2020 about 318,000 annual riders just on that green route. Now, of course, with ridership, what's the route's makeup and what's the cost? And again, I'll give you an abbreviated briefing today. The next slide, please. Here's some performance criteria. The 100X exists. So there's another illustration of an existing portion of your network that benefits by just a little bit of connectivity. We looked at putting the express service out to the airport, extended a mile or so, I guess it's just under a mile, over to the new mall. And this is just configuration of feasibility and concept of routing, and these are the parameters we put in to run the model. Next slide, please. So these are our favorite routes that I mentioned. The green, brown, that is brown, and blue. The blue, I just point out, that takes you from Garden City across the 80 corridor into the downtown, connects in the core of the system. Next slide, please. And that must be money. I always do that with money. Yep, it is. And so, just trying to pull this all together and make the points for you is, we looked at this entire mobility approach. So in the top area of the tables, you see how we took those priority routes and estimated what their cost would be. My caveat there is that $389,000 for the 100X wouldn't be extra cost, because it exists for the most part today. You may not see that little line underneath the fixed route services is the zonal service. And there is just, again, a conceptual level of 2 zones, roughly costing $650,000 to $700,000. And there may be some application here based on the demand and the need we define. And then I did a little bit of a spreadsheet there on the van pool service. And there's various ways, and we're working through that now for you all in developing the program. You can buy the vans outright. Maybe you could get some federal funds and get an 80% match. Maybe you can do something with the state, like other parts of the state have. You could do a contract where you turn over to the leasing firm. A number of firms now are going into it. V-Ride is one important one across the country. And they'll wrap up the whole process for you in providing you maintenance, a lease cost, Usually the participants share the gas, or the employer shares the gas. So we give you a little bit of a flavor of, by unit, you could be operating a number of van pools, which would be really appropriate for some of the suburban environment in the West Chatham area, and might even, our recommendation would be, as we develop that program, is to create private sector partnerships, because there's benefits all around for getting people to work. What we would need to do, next step, this being a feasibility study, is really refine those zonal services I mentioned, based on the numbers we had. And again, this is to be refined with the new issuance of the valuation throughout the county. But we had an estimate that those areas not currently in the district could generate $1.7 million. Well, we could chomp that up real easy if you start adding all the numbers that we have on the priorities. But it's not unlike your existing approach and budget. There's far more demand than you can afford now, and you prioritize, and you get some good service out. So that's the emphasis for Terry, that there is a CAT budget process right there. Next slide, please. So this map just illustrates, you can see in green are those areas of the county that are not currently within the district, and the tax does not apply. And here's my recommendations for you. Well, one is to accept this analysis if it all makes sense to you, and surely the staff will be reviewing that, as Dr. Reese mentioned. If that is the case, the board may provide direction to the staff to incorporate that into our strategic plan. If I've learned anything in my years of public transportation, if you don't have a list of wants, you never get. So part of that is to build it into our strategic plan, and also coordinate with the MPO process, particularly when we look at some capital needs and future operating needs. The board may consider taking, this board might take a recommendation to the County Board of Commissioners to indeed expand the county district, because that's their authority to do that. And then finally, if that is affirmed by the Board of County Commissioners, to direct staff to take these initiatives, these concepts, and refine them into real schedules, to real budgets, and again, make another priority aspect. If anything, I would emphasize with the approach that we took and the feedback we got would be indeed make some fixed route improvements, but really take a look at that van pool program. This would maybe a really good pilot area to initiate that program. And I believe that's the end of my presentation. Thank you.
Any other questions for him? Any other questions? I mean,
You
this
have all
is
the
really
details
important.
there on the van pool.
We have quite a bit from a national perspective, and as I said, we're working with Shalana now to actually develop the programs within the existing service area. We think it will work, and we just need to talk to the right people, get into the HR departments, talk to the CEOs of the businesses, and we think that will be very effective in this region.
Mary?
Just a comment. This is wonderful. It's not quite digestible sitting at the table today. I think this is a subject matter that should have been brought before the Systems Development Committee.
It's on the agenda for the next one. This is the draft final, so
all right.
You will get as much time as you need to come up.
Thank you.
It's on the agenda for system development and for finance. It's not on the operations committee. Sorry, guys.
Thank you.
When you were doing the presentation to the different entities and all, did you talk about how it would help them, like reduce pollution, the congestion, where there's so many vehicles, and especially they're getting on that parkway at this particular time, and then of course the people that use the transportation system saving money. But when you have that van pool, there are areas in those particular sections where people can park their vehicles and then get on a bus to come into the other areas.
All good points. I would say in the Pula area, there was just a total objection of the taxation. And then I think there was a perception problem, as we attempted to explain. One bus an hour isn't going to really impact that congestion. And there was kind of a sense, well, how would one bus really impact the congestion? Well, they're stuck with that congestion based on the land use development, but there's potential now, particularly that mall has employees, service employees that would really benefit from accessing. I would even suggest that we all reach out to the mall as far as developing van pool programs or this express program so they could access the network. But again, I mentioned it's typical. You kind of get boxed in with auto-oriented development, and then when the congestion occurs, it's, oh my goodness, what are we going to do? We don't want any more vehicles out there, but buses can move a lot of people.
Yeah, especially and those merchants, 85 they got now, and looking to, I think, add a few more, that the bus service, especially to that big one that just opened up, that could bring in, quite a number of new customers.
My takeaway from the two meetings, and I went to both Garden City and Pooler, was the group in Pooler is 100% against this from a taxation standpoint, but their perception was also that buses on Pooler Parkway are going to make it much, much worse. Not only Pooler Parkway becoming up Route 80, they were an adamant bunch about bus making it worse. So they totally don't understand taking the cars off the street. That's not part of their thinking.
Yeah.
Because they're going to drive their cars regardless. So in their mind, these buses are going to be taking people into the outlet mall, just making the life worse. So I think we have a perception problem we have to get past with them. But the Garden City folks, and Wayne was there, I thought want this. That was the takeaway I took from it. They'd like to see this. And the comment I'll add to it is living right across the street from Garden City. If you link this route with something on Ogeechee Road that gets people downtown, you may pick up some of the people coming out of South Bridge, which right now are not going to use the Route 17 routes. And there you do have parking. So that was just my takeaway from the meeting. I thought Garden City would like this, but I thought Pooler was going to be fun.
Wayne, did you have something?
Yeah, I was going to ask, this presentation, do you have plans to make this presentation to some of the people some of the elected officials?
I think it falls on me now.
Okay.
So the approach we're going to take from this point on is to say the staff has got to sit down and we'll digest it, because to piggyback on what Mr. French has said, what we know about Garden City is not anything new. The issue with Garden City has been for the past 3 or 4 years is the tax base there to support the service that they need. So we have to look at it in terms of what type of potential expansion are we talking about. One of the ongoing comments we heard from Pooler is, well, people in Pooler aren't going to use the bus, people in Pooler aren't going to use the bus. The reality of it is the people in Pooler go somewhere else, and they benefit from the bus being in those other locations because, as you can see, nearly 15% of the trips that are made by CAT. So it's 15% less traffic on the road that you benefit from, but you don't pay for. So as we go in, we'll be meeting with and one of the things we've done in the past is we've met with staff, and I understand with some of the comments back from Garden City, some of the elected officials felt as though CAT had neglected them. So this time we're going to rely on the chairman here, and we'll go beyond the staff and reach out to the elected officials so they'll hear us firsthand in terms of what the options are, what the proposals are. As I said, and what we would look to do is come back to the board next month with a recommendation from staff on what we'll do. But we'll have to fill it out with Pooler, with Garden City, with other municipalities, as well as with the county, just to see if we can scope some type of compromise on expansion.
I thought in Garden City, we had a lot of elected officials in the office.
About 3 or 4.
And they seem to be more confused than anybody about who had the authority to do this. I mean, they were totally lost.
Yeah. I mean, the one thing in Garden City that I heard from them was that we want to be your partner. You know, we just bring us along with you, consult us, get our input. And I think they kind of felt like that maybe they hadn't been heard in the past. So that's why I was asking where the presentation.
Yeah. If we, depending upon the position that the board takes at the next meeting, if we have to go before the full county commission, we'll rope Rob back in. He'll like coming to Savannah in June.
I love y'all. Could be worse, could be August.
And one of the things too, where it was mentioned, you know, about the elected officials, because that's really important. It's a need that you have a message that how advantageous it is for the transit center, I mean for the CAT, is that, you know, what are all of the advantages and all. And if you have that and don't get into other things, you know, at that particular meeting, that you drive that point along so that they can see that it's going to be good for Garden City or Pula or whatever, you know, municipality it might be. Because I've seen that in the past, in years past, when I was when I was chairman of the county commission, and how, because as you were stating about the confusion there about, you know, them not understanding and all. But once they can see all the advantages, and that's going to make a big difference.
Well, just to pick up on that, I think that they need to see the consequence of not expanding, because the number of cars are going to continue to grow with the growth on the west side. So the consequence of not bringing in some form of transportation is significant.
Yeah, and then we can go what we've already, you know, what we've been talking about, the difference in how in many people's lives by having that transportation, especially when you got 24,000 people in Chatham County that don't have transportation. 24,000 went from 2000 to 2024, 24,000 people. And that's a big number, and that has a big effect on the areas that they don't have transportation. Okay, let's go.
Thank you, Mr. Chairman. I think Robin Cutter, I was able to do some late night reading last night. I think they did a wonderful job in terms of putting this together with the amount of detail that was there, in terms of what they look for, the potential markets that are there. So thank you, Rob, for all your work.
They also, I thought, handled the meeting very well. Their presentations
well, he was
were good, and he took some very good questions.
He was smart enough not to let me speak. That's what I congratulated him on. Yeah, you know, they don't allow me to do public speaking too much for some reason. I wonder why.
Too big of a target.
Executive Director's report.
Thank you, Mr. Chairman. Executive Director's report is before you. We had a 4% reduction in a decrease in ridership by 4% on the fixed route side. However, we continue to still be up 3% year to date. Complaints are down nearly 40%. Productivity is up to 22 passengers per hour. On the paratransit side, ridership was up 11%, productivity up 9%. All the other variables remain constant. Year to date, we're still up as a system 3%, fixed route is 3%, marine is up 3%, paratransit is up 9%. In terms of the state funding, I just passed around a document here that went around that's entitled proposals for transit investment. The state has put together, they have adopted, or they will be adopting a hybrid approach in terms of how the state funds will be distributed. They will use part of a formula allocations to set the limits in terms of the size of the organization, but in terms of the size of the transit systems or the communities they serve rather. And then once you're in that, those funds will be competitive. They put together an advisory committee to review the proposals for projects and make recommendations in terms of how those funds will be awarded. And I am the representative for the state outside of Atlanta. So outside of the Atlanta metropolitan area, the Georgia Transit Association appointed me as a representative to evaluate the projects. So what you have here is a list of the projects that we have submitted for the Georgia for the transportation investment program, which is a streetcar expansion, a commuter transit enhancement. Some of the programs that you saw Rob list there, which include regional parking rides, van food service, express service, Abercorn enhanced service on Abercorn Street through bus rapid transit, as well as our fixed route bus replacement program. So this is just a synopsis of the call for projects that we've submitted and put in, and of course it will require further refinement, votes, so on and so forth. But we've thrown our name in the hat on these 4 projects. In terms of ADA functional assessments, we had 32 interviews during the month. The group 13 were conducted for new applicants. Of those new applicants, 7 were approved in-house, 2 were denied, 7 referred, 4 were referred to functional assessments. In addition, there were 19 that took place under recertification. That were all 19 of those that were on for recertification were approved. There were 2 appeals during the month of February. As a follow-up to last month's meeting, we put together a new customer service training program for all marine employees, and all those employees will have completed training by June 15th.
The 2 denied in-house, is that a correlation between the functional assessment?
It's not a correlation, because if there's it's 3 categories. One is if it's clear that they would qualify, we'll approve them in-house. In-house. If it's clear that they're not, they are denied. And then the ones that are questionable are referred to the functional assessment.
So the 2 that were denied were not, they were
not qualified.
Okay.
Yes,
thank you.
Yes.
I just have a quick question. Do you feel that this, you were up 11% on the paratransit as far as productivity, and I guess what I'm really looking at, I don't know if that has much, ridership is. Do you think that's going to decrease with this screening process?
It is not going to decrease. The concern is how much it grows. And the notion is we've got to some way find a way to limit the growth.
Then are people that are currently qualified to use it, are they going through any evaluation, or is it just new people?
We did the research, yes ma'am, we started the recertification process of the ones who currently
So
use
in
it.
theory it could, if you have riders that have not been using it properly.
Yes.
Okay.
It could, but the problem is during the month
you had more applications.
You had more applications.
I understand. I'm just, because that is such a big expense for us.
It is.
And I'm trying to get a handle on how that's going to affect us in the future.
It is a major concern. There are systems whose paratransit costs are now rivaling that of their fixed route costs. And it's a major issue that we have got to stay on top of and control the growth associated.
I understand, and that's why I asked the question.
And then there's just an administrative change that I want to notify the board of. It's a memo from Terry to myself. Last month, the board approved the purchase of the MV1s off the state of Florida contract. We ran into an issue getting the required documentation from the state of Florida to meet the requirements of FTA policy as well as our policy. So I will approve the administrative change that I want to notify the board of that change that we will purchase off of the state of Oklahoma contract, and we have received all the required documents for that.
So that particular one is the one to adopt.
Well, we can adopt it. I just wanted the board to be aware in case there was a question that I approved the administrative change with the way the vehicles were procured, but the procurement and the price and everything remain constant.
Any other questions?
No, I was just going to ask, in accordance with our procurement policy, we don't have to take any action on this?
I don't think so, and once we get all of the documents that we've received reviewed, it's quite possible, if you prefer, we could bring up a board report back to the board. But because we had already approved the purchase from Florida, we wanted to notify you that we weren't able to get the documents, and we're gonna have to make that change. So if it's the board's preference, we can surely bring back a new request for approval once we've had a chance to review the current Oklahoma State Board.
I don't want to hold up the process. I was just asking.
Want to be procedurally correct.
Right. Correct.
So the Florida folks just didn't give you what you needed?
That's it.
Yes.
After they had committed to doing it, and then after follow-up calls, emails, follow-up calls, and no response, it's like, well, we've got to get the vehicles, so
I would go ahead and make a motion that we approve the change recommended by staff in order to expedite the process, and you not have to bring it back.
Second, if that's permissible.
It is.
Okay, we have a motion on the floor to approve. Any questions on that? Any questions or comments? Okay, all in favor signify by saying aye.
Aye.
All opposed? Motion carries.
that's it, Mr. Chairman.
Okay. Next is the unit updates and safety and training first.
Thank you, Mr. Chairman. The safety and training report is in your packet, and I will entertain any questions you may have.
Now, this safety and training is very important, because we've had some questions and some concerns about things in the past. And the safety and training update is really good for the CAT employees, especially the bus drivers and others, because it makes a big difference. Because number one, we want to make sure that the passengers are safe in that situation, plus that the drivers are safe also, because they are the ones that provide the service that we oversee, and that's really important. So we have to keep that up to make sure that we help the bus drivers and all, and it makes a difference. We had the other day, a few days ago, we had the area people on Leadership, Georgia, that was over at the center on Gwinnett Street, and there were quite a few of them. And we went over, some of the staff people and myself went over some things with them and all. They were quite impressed on what we were doing, how we were operating, and then the command center there, where we've got all of that technology there, how it's how it's done, how we can see the situation on the buses and all of that, and how we can communicate and all of that. And they were really made some good comments about that.
Did you show them the new app?
No. Yeah.
You had to know that was coming.
Yeah.
Okay, next, service delivery update.
Thank you, Mr. Chairman. The service delivery report is in your packet, and I'll entertain any questions you may have.
Any questions? Any questions at all?
So the Airport Express is so far down from last year, is the 34% over last April? Seems like this is just really struggling to take off.
Yeah, it is. And some of the changes might be, as we discussed, that a mile detour on that takes you right into the heart of where the action is in the pool. But as I say, that's one of the routes we are watching, and depends on how the service expansion goes, if we're able to increase. The event that you see going on outside now is with the Tourism Leadership Council that our marketing program is put together. And they're meeting with the hoteliers downtown, and one of the topics of discussion is the 100X, to try and get that information into all the hotels downtown. So we're still.
You don't think it has anything to do with increasing the fare?
No.
I still think you need to get that marketed before people get to the airport.
Right.
So talking to the hotels is a good first step. So when somebody gets off the airplane, they're looking for the bus and not the cab.
Right.
Otherwise, they're going to go to the easiest spot, which is the cab line.
Right.
Yeah, and they can pass that on, especially what you're talking about, Howard, when people are making reservations.
Exactly. So that's a good event to have that side.
Yeah. Okay. System development update.
Thank you, Mr. Chairman. The system update is in your packet, and I will entertain any questions you may have. Just one of the highlights there is to highlight what the event we had last week with the chairman showcasing all of the improvements we made at CAT to the Leadership Georgia program. So it's pretty good.
Okay, financial update.
The financial update is in your packet, and I will entertain any questions you may have.
Any questions?
Mr. Chairman, I just wanted to thank CAT staff for participating in the Fair Housing Luncheon that was referenced in the development update. Appreciate that.
Okay, no more questions? Old business. Shad,
No old business. Yes.
where do we have? Yeah, that's right. On, I have here now this is the title, this
New business.
yeah, on the new business. No old business, new business. Okay, once a year, we evaluate our executive director. And I've got the information in each one of these packets, and it's got your name on it. And we'd like to have that turned in so that we can have this by the end of the month. That's important because of the time element on that. So, I'm going to pass these out to all of the members right away. Okay. And please get them back in. And this is confidential now. So whatever you put in those packs, is confidential. And that's really important. Yes,
Trying to
Mary?
use them at the Gwinnett Street location, no.
Oh, you can just call Beverly. She'll give us a call.
Okay.
We'll be subject to after the event.
While these are being passed out, I was wondering if Dr. Reese or maybe Ms. Michael could report on the new small dollar loan program that CAD is working on with respect to making small dollar loans more affordable for our staff.
Sure. The lifeline loans is what he's referring to.
Director Burker is referring to the Life loans that we will be introducing to CAT employees during our safety meeting this month. The Lifeline loans are designed to help our employees avoid going to predator lenders like Title Max and other lenders that charge exorbitant fees for small loans. This particular loan is with Georgia Heritage Federal Credit Union, and employees can get anywhere from $300 to $1,500 on a loan. And yes, the interest rate is a little higher than it would normally be. If you had, the rate will vary based upon the employee's credit history. So it's a little bit higher than your standard loan for someone with fairly good credit, but it's nowhere near as high as Title Max type loans. So we'll be introducing those loans to our employees this month.
The reason I bring that up, the county just had a presentation on this at our last commission meeting, the company that they're using, and you might want to talk to the county.
Yes.
Because there were some real benefits with this company versus some of the others. So please talk to Michael Kegler about that. And say, I can't remember the name of the company. James, do you remember?
No, I don't. But the 60% I thought was a bit high.
Right, but there was a graduated scale of you know, incentives to getting it paid back earlier, and so please talk to him.
Sure.
It sounded, and I'm not in the financial world, it sounded like they had done a lot of research on this and that it was a good opportunity. So before you make any decisions, just talk to Michael.
I'd be happy to.
Thank you.
Yeah, I simply appreciate you being open to a product where people who typically cannot qualify for small dollar loans and do have to go to lenders that some would consider predatory. People who've been with CAT for only 6 months will qualify automatically for a small dollar loan. And it also allows them the money, the payback is withheld from their paycheck, and the money continues to be withheld even though the loan has been paid to establish a savings account.
And that's the best benefit of all. Once the loan is paid off, the deduction continues unless the employee elects not to have it, but most of the time they're used to it by that point, so it'll continue on into a savings account.
And I think that was part of the one with the county as well, but just
do a comparison.
Right. And this doesn't cost CAT anything.
No, it just our little time for putting in the deduction and sending forth the payment to Georgia Federal Credit or whomever we go with.
Okay, and as most of us realize, that's really important. That is good for CAT being able to do that, because I can tell you, I had an employee of mine that worked for me. He was a manager, and his sister went to jail for using drugs, and she had 6 children. So he took over taking care of those 6 children, and he needed money. We didn't know about it right off the bat in our company, and I found out that he borrowed $200. He was paying it on a weekly basis. After about 7 weeks, instead of the $200, it had gotten $600. In that short period of time, he borrows $200, paying on a weekly basis, and then that's gone up to that amount. And we did something for him, but that's terrible when you've got those payday loans and they're able to increase it with some kind of situation that is not covered by the law at this particular time. Okay, any other new business? Okay, call the meeting. We will adjourn now, and you can go over to the room over there. The things are over there. All right, the food is over there now.
And Mr. Chairman, just remind you want all the board members to read this cover to cover.
Okay.
They got a test on it.
Oh, yeah. What he would like to do, y'all listen now. What he just said, he wants everybody to read this from cover to cover and take a test on it.
All right.